Yeah, so we did um, the start of this presentation, part one, last month. If you guys want to go check that out, if you didn't see that part of it, it's on YouTube. And I am going to do a teeny bit of a review of that for anybody who may not have seen the first part. But yeah, I mean, we're here kind of to talk about Meyerson materials, but you can apply this to a lot of other material choices out there. So, the big thing to know about Meyerson is they've, been around for more than 100 years, and most primarily on the removable side, which is kind of rare in our industry. And so they know what they're doing, and the big push behind Meyerson coming up with, materials for teeth as well as materials for bases, major connectors, if you will, is the fact that they've made denture teeth for over 100 years, and we're the first to release Vitalium for metal frames, and as things progressed, they have moved right along with technology. So, of course, they see 3D printing coming along and see that labs will possibly get to the point where they can be their own denture teeth and partial teeth manufacturers. They wanted to not fight against that. They wanted to move right along with it, coming up with Trusana. As far as bases are concerned, they've had the DuraFlex, the Duracetyl, and the VisiClear materials that were injectable. And actually, for quite a while now, about 10 years, they've had a millable version of those materials. And so we put together this two-part series to kind of go over how you would design and produce the teeth and the base. And then on the second, that was the first part. The second part, we're going to go over, well, once you have the base and you have the teeth, how do you then fix them together and polish and deliver that to the doctor for delivery to the patient? And so as a little review, we're going to talk about doing a DuraFlex based partial. DuraFlex, for those of you who don't know, is a material that is similar to a Valplast style of partial. Now, it's very different plastic from the nylon that Valplast is made from, but as far as the look and feel of it, from what we're going to show and designed to, with this presentation today and the previous presentation last month, the look of it and the design of it is very similar. DuraFlex and VisiClear are the same material, just VisiClear doesn't have any pink pigment in it. So keep that in mind as I go through this process. If you wanted to create exactly what I show you in the pink, you'd have the option to produce it in the clear VisiClear as well. So really quickly, this is a quick video of the design process. And so I'm just going to kind of zip through so you guys kind of get just an overview. Again, if you want to really see the in-depth and kind of me narrate through this process, you can find that on YouTube, and I'm sure you can receive a link for that. And so I'm going to kind of move through. You have a base, you create your teeth, you'll go through and position them, get them exactly how you like. This is one thing that I do like about digital teeth, is instead of you taking a handpiece and grinding the heck out of them, you can sit there and just move little incremental areas to adjust the bite, to do things like that. You can even twist the teeth a little bit and move them around. And so you still keep some anatomy to the tooth, even if it's, got a really strange, maybe protruded opposing tooth and you wind up having next to nothing of an occlusion left, you can still keep some anatomy and stuff easily with digital design. So then here we adapt the bottoms of the teeth. We're also going to smooth out the bottoms of the teeth just to allow for the milling machine and the software to have nice smooth edges to deal with. Next, we'll create the retention. Now, these teeth will not be able to be bonded into the base mechanically, right? We're going to have to use mechanical. And so this is using an attachment tool to create holes, if you will, in the bottoms of the teeth, so that when you actually produce the major connector, which we're starting to do now after we've produced the teeth, you'll have a post in that major connector that will be a nice mechanical lock when we place the the teeth on, and I'll show you the actual end result of this digital design in the second part. So you'll see here in a second, once you adapt to those teeth, you'll have a post in there. Just a sec. All right, and so here's where we'll adapt. And now you'll have that nice post that's protruding to match the hole in the bottom of the tooth. So that, you know, we're reverse engineering. Essentially, previously when we injected, we drilled holes up in the bottom of the teeth and we injected the DuraFlex or Valplast up inside the tooth to lock it in place. Now we're creating the tooth first with a hole and then adapting the base to that so that we have you know, mechanical retentive apparatus that'll make sure that those teeth don't come loose. That was Exocad. 3Shape is a very similar process to Exocad, so you can use the attachment tool to create the mechanical retention. So the workflow is very similar to each other. Both softwares I enjoy and like. When you moved it into your mill, I actually have a VHF mill. I have a 52 DC from Roland. I also have the newer, well, almost brand new, just a couple months released DC 53. And that 53 is chewing up some plastics. I'm knocking out a partial like this in probably about an hour, maybe an hour and 10 minutes. So it's as fast as any mill out there when it comes to plastics. I'm really enjoying working with it. I let 6 cases. It's a 6 puck changing mill. It holds 6 pucks, and I let it go last night. Took about 6.5 hours to mill 6 cases. Came in the morning and they were ready to roll. So very happy with that. You know, the big thing is making sure when you see undercuts that you position your appliance so there's no extreme undercut in one area. Now the mill is going to be able to reach a lot of the clasp areas like this from the top and from the bottom. So it'll reach this undercut from the top, it'll reach this undercut from the bottom, not a big deal. Be careful around your sockets to make sure that it's able to access the sockets easily, to make sure that you mill those as accurately as possible. You don't want to have too much work to do to fit your teeth to the base that you mill. And I'll talk about a little bit, but you will have some work on probably 50% of the cases that you produce, making sure they drop exactly down into the socket. Sometimes the milling machine just can't mill certain areas as precise, but usually it's small adjustments and then the teeth will sit right down. But positioning things in place so that it's make it as easy on the mill as you can. You know, we produce the base in DuraFlex or VisiClear. We talked about they're one and the same, just one's clear, one's pink. We have Trusana to print the teeth. Now you could mill the teeth, or you could print the teeth out of Trusana or whatever material you're happy with. The only thing, you know, is positioning. When you're doing individual teeth, you know, a lot of people haven't really got into just milling teeth. A lot of people are doing like full arches for dentures, or they're doing all on 4 cases. And in that instance, you have a large amount of supports. And a company like Asiga, the supports that are placed by the automatic support placement is supports to support the appliance, not necessarily to be strong enough to let the appliance or the teeth go through the process. All right. And so initially, this is what it'll look like for automatic supports. And you want to keep the supports nice and small so they just peel off and leave almost no residue left, right? So I like keeping them small, but if you leave it limited, especially when you only have like 2, right, what'll happen is the supports that are placed are enough to complete and have no islands that are unsupported in building your teeth. But the individual anchors, once you get into the body of this 2 sets of teeth and you have only these supports, it'll tear the supports in half. And so as it peels it off that bottom of that back, it'll tear them in half. So what I like to do is add supports from what is the auto support system. And it's simple. It's just a button to click to say add supports, and I'll go around and I'll add more. And the only reason I'm adding is to just make this stronger. So when the build plate lifts and it peels those teeth off the bottom of that vat of resin, that it doesn't just tear and break those apart, and it leaves either peels it right off the build plate, because also adding more supports also adds more surface areas of the build plate. So I guess keep that in mind. We're not really here to talk about the 3D printing, but I figured I'd add that as we're going through. And here's a good example of my kind of day-to-day in my lab. I'm printing a lot of my denture teeth for a lot of my cases. I've really tried to convert over to, Zahn has a nice translucency to it. It really is as close as we've gotten aesthetically to, as beautiful of as a carded tooth. And so I'm doing a lot. So I build up, this is one shade, right? And so you want to run, if you have all A1s, you want to build up those cases. And it is weird in the workflow in the lab, instead of just going over to the tooth cabinet and picking out A1 and for this case and A2 for that case, you will stack up cases. You kind of pre-design cases a lot. And then I have cards that tell me that it's A1 or A2 or C3 or C2, C1, whatever it is, so that we can pack those together. And then once we get like 3 cases, they'll take them over, load them in, and print those sets of teeth for multiple cases in one batch. So you can see this is our premolars you saw on the previous screen, and these are our molars. You can see the difference here is we have the socket. These teeth were for dentures, so they were going to chemically bond, so I didn't need to create the shaft to support those because we're dealing with mechanical. And so here's our case after it's been milled. This was milled in the DC, the 53 DC, and you will always have some of this, like little hairs down in the socket, because this is more precise and it'll kind of go around with the tool. It really doesn't hurt, doesn't bother anything. You can take a little blazer torch and just flame over it real quick, and those will just melt away to nothing. You'll never know they were there. When you go to finish your teeth into place, a lot of times if you have an issue, it'll be in this area here, right as it butts up against the adjacent tooth. Things get a little tight. Sometimes the software will kind of adapt things in that area because things get tight and there's minimum thicknesses. And sometimes I'll find I'll have to go in there with a burr just to open that up, or go to the bottom of the tooth and remove a little bit just in that area if I have a difficulty in fitting it in place. You can see how we designed our clasp to fit into place and engage the undercut but not be too obvious. And here's the teeth. On this one here, it dropped down pretty well. Again, I had just a slight amount of adjustment there and it dropped right in place. And you can see I still have the support mechanism on the teeth. And we have our post. Now, there's no real undercut here, right? You have a post and there's something to be said about the parallelism of the post, but you still have to create a mechanical retention. This here is a video. This is straight out of the printer and a milled case, and you can see the posts here, and you'll see the cases drop into place. And I want to preface this with saying that's not, like I said, about 50% of the time you'll get this where they'll drop right down into place. If you create a little bit more of a gap there, you have a little better chance of that initial fit happening, but then you might have having a little bit of gap. So again, 50% of the time you have to spend 5 minutes adjusting a little bit to get them to drop. It's not that big of a deal. And so again, you have these posts, but no real mechanical retention yet. And this is where you will have to put your hands on the case. This is something you can't just tell the mill to do. And so what you're going to do is, this is a burr. This is probably about 1 millimeter across, just a nice little round burr. And what I'll do is I'll take the areas where I have a little thickness and I'll just grind a little trench in there. A little bit of an undercut is all I'm looking for. And you don't have to go around the whole socket, just a little bit here. And that's really going to lock it down in that socket once we bond it into place. And then to kind of lock that post in, because that's going to be our lateral forces to make sure the tooth's nice and stable. I'll take that same burr, and if I have the room, I'll punch a hole right through, right through those posts. If your post couldn't be that long, or you don't, there's a little bit of a limited occlusion, you could always take a disc or maybe a little smaller round burr and like put a slice on the side of the post. So if this is the post, just kind of put a slice on the sides of it so the material will kind of grab hold if you don't have enough there to actually put a hole through the whole post. But the hole's the best, right? Because that's literally the resin that you use to actually bond it into place will literally flow right through and lock that in place. Also, producing your teeth as a splinted unit, it makes for a remarkable amount of retention. So really, I think in the end, on these cases, you're getting a more retentive lock of the teeth because you're able to create the nice chamber inside specific to the design of the tooth, and they're splinted together. And so that they work together to be extremely retentive. So actually bonding the teeth. So your biggest concern is actually using a resin that bonds chemically, or at least mechanically to your tooth, whatever you choose. So in this case, we use Trusana. Trusana doesn't have a bonding resin yet. It's very close to being done, but we don't have it yet. But I have found that the Lucitone bonding resin that is used for the Lucitone teeth has an incredible bond. And we actually have had it tested, and it's does a really good job. It almost becomes one thing with the Trusana. So that the Lucitone bonding resin is a really good option if you're using Trusana teeth. If you're using another company's teeth, do that research and find whatever resin they might have to bond to those teeth, or what they might recommend. If you're using acrylic PMMA, if you're milling the teeth, again, find out something that will chemically bond. I have found that GC's acrylic bonding agent, right? So whenever you're gonna add GC resin to acrylic, they have a primer or a bonding pre-treatment, which is a liquidy resin that you paint on and you tack it in place for a minute in the light cure, and then you build Gradia onto that. I actually found that works really nice on PMMA. So you score the bottom of the tooth, sandblast it, you just get it roughened up, paint that on, hit it with the light for a minute, and then use some light cure resins. Again, I am not part of whatever puck that you're using to mill your teeth, but that is something that I've used and had really good results with bonding to it. So keep that in mind, but do your own testing, call companies, find out for yourself for sure with that. Because your big concern is getting a chemical bond to your tooth, because you're going to have a mechanical bond in the socket. So anything that's going to set up and get solid, it's going to be fine in there, as long as it has good strength. I mean, you could even use something as simple as acrylic. I've leaned away from using acrylic. It'll tend to show a little bit of a line of demarcation at the neck of the tooth. It is a little bit soft. Acrylics are kind of made to have a flex to it and a movement. And a lot of those you would be using like a repair resin, acrylic. So using something light cured, it blends in nice. It's going to bond nice to the tooth with no real line of demarcation. I'll take a brush. I like using a brush. I'll dip it into the resin and then I'll paint it into the socket, so I can kind of push it through the hole in the tooth, and the bristles will kind of go through and it really coat everything nice. And then I'll take my tooth and put it into place. When you push it down, it's going to ooze a little bit. The brush is also really nice. Just keep a napkin over to the side and just brush away. Trying to use a Q-tip, you don't really get up into the interproximal. You don't really, you'll have a lot more left over. You can do a little more precise removal of the excess with a brush, I find. And then when you're done, just spray the brush with a little alcohol, wipe it off on a paper towel, and it's good for the next time. So it's not like it's a one and done with the brush. It keeps going. It works out, perfectly fine. And like her, Fran, did you want to go over one of the poll questions?
Absolutely. We're going to start with poll question number 1. Do you currently use Myerson's DuraFlex material when milling partial appliances? If you wouldn't mind just answering that poll for us. Thank you.
I'm reading one of the questions now while we're waiting on that a little bit, just to get that out of the way. I have here, why would you support the teeth with supports on the occlusal surface rather than the bottom of the tooth? It's a good question. I have found that both work fine. On the occlusal, if you use small enough supports, and I kind of went over that with the Asiga supports, when you tear them off, you can barely feel just a slight roughness left. That's about it. So it really doesn't affect the anatomy very much at all, if at all. On the bottoms, it will kind of go up into those holes, and if you don't get those perfectly parallel, it'll want to support up in there, and you'll have to go in there and grind them out. Not that big of a deal. You're going to have to adjust those a teeny bit to get them into place anyway. So that's really up to you guys. I haven't found an advantage or a disadvantage to each one of those. So attach your supports to the occlusion, attach them to the bottom. Some people will even turn them on their side and attach them to the lingual. That all works and does fine. So that's a good question, and the answer is both. All right.
We have the results. I don't know if you want me to go over that with you now, but 8% said yes, they are using Myerson's DuraFlex, and 92% are not.
Okay, I don't know. Good. Well, that's good. Well, we'll be able to introduce and get many people to it, possibly. At least the idea of all right. Yep. So once you've placed the teeth with the resin, they'll be like here. It's really up to you. At that point, you could kind of clean up any excess that you may have missed with the brush. Any little paper thin or just slight amount that's over the tissue part, you almost can't get that perfectly clean. That will flake away, right? Because one great thing about DuraFlex is it doesn't absorb any moistures and resists adhering to stains, bacteria, and smells. Problem is it resists kind of chemically locking on to most everything else as well. So what you would want to do is probably when you polished, if you were to do it with pumice or with Myerson's polishing kit, which I'll show you in a little bit, it would knock off that thin little film. So you'd get rid of it then. So you don't have to go crazy unless it has some thickness to it or some bulk to it. You might get a line of demarcation. So you could take the teeth and you could just high shine the base and the teeth using the polishing kit I'll show you in a second. If you are, I always like to take a diamond separating disc and give the teeth a little bit more of a separation between them, a little bit more of a defined separation. If I'm going to polish with pumice or Myerson's polishing kit, I won't go that deep. I'll get just a little bit of separation. I want to create a food trap or area for stains to be able to kind of gather. So I'll just run that separating disc just a little bit in. If I'm going to use OptiGlaze to highlight the teeth and give it a polish, then I will cut a little deeper with the separating disc because the OptiGlaze will actually fill. And so you'll get that more illusion of depth, but you'll actually fill that and won't allow for stains to accumulate. Now, I want to be clear, if you're going to OptiGlaze, you cannot OptiGlaze the DuraFlex. You would have to be a little precise with your brush and just do the teeth, but you can usually what I'll do is I'll polish the base, get it exactly how I want. I'll then take a brush, and if I hit the teeth any and got them a little shiny, I'll dull them out with an abrasive brush, like our polishing kit, but in a handpiece size. And then I'll use the OptiGlaze to either, add some characterization and also give it the shine. But cut with the disc slightly if you're going to polish, cut a little deeper if you're going to OptiGlaze. Here's the polishing kit. The polishing kit comes in 4 different brushes. They have 4 different amounts of abrasiveness. Yellow is like your pumice. It's going to get all your burn marks, all the striations from the print process. It'll get the surface the way you want. Red will do that a little bit more, but put just a finer scratch on the surface. Then when you move to blue and green, those are strictly just putting a finer scratch and starting to develop your shine. And then you can high shine it. This is the fine scratch remover from Myerson. It works really good, but most high shines will work to give the teeth and or the DuraFlex a shine. I will flash heat the DuraFlex with a Blazer torch. That Blazer torch model number is from the company Blazer, and it's model number SI100. This is a torch that blows out just hot air. There is a video on Myerson's YouTube channel of how to polish DuraFlex, and I show that torch and that part of the process. Flash heating the surface will give you a look, of it being very high shined, and it makes for a longer lasting high shine. It treats the surface in that it holds that shine much better. So I would recommend that, and check that video out when you have a second. It's only like 7 minutes long on YouTube. So get your polish, and these teeth, so the base is polished, the teeth are OptiGlazed. And so you could color, you could add some blues to the incisal, you could add some color to the neck of the tooth, and then of course put the OptiGlaze clear sealant on to give it the shine. You can see back here, I talked about in the first video, actually doing a circular clasp around that back molar. Those make for a nice stable clasp and do a really good job for retention, especially on teeth that might have limited retention. Here's our OptiGlaze kit. They come with multiple colors, everything from blues to reds to oranges to pinks, grays, just anything you could think of to get tooth color or a tissue to add to a tissue color. It also comes with 2 different clears. One is a very liquidy consistency. One is still liquidy, but less. And that's nice depending on the look, right? If you want it to have more texture, the more liquidy version allows for more of the texture of the underlying appliance to come through. The thicker version, which is not thick, but the less liquidy version will give you more of a smoother surface. So you can sometimes use that in different areas. Again, we only use this on the teeth, not on the DuraFlex base. It won't, as the DuraFlex flexes, it'll just crackle apart because it's not a flexible material. And here's some extreme versions of what you could create with the OptiGlaze on Trusana, or this is Trusana. Trusana is a very translucent material compared to a lot of 3D printable materials, even millable materials that are available. So I don't know that you'd be able to accomplish this kind of look on other materials, but this is specifically Trusana, and this is a material, how it'll take that colors and really, basically you can have it look like a high-end denture tooth. All right, so this is probably another point for another poll question, Fran.
Absolutely, Chris, here we go. Our second poll is, what mill are you currently using?
Yep, so as I said, I have 2 Rollins and I have 1 VHF. I like them all. They all have their pros and cons. VHF is a very robust mill. It is overbuilt for a tabletop. I don't say overbuilt. It's overbuilt compared to a lot of other mills that are tabletops, right? Very beefy mill. Has a lot of safety controls as far as making sure that everything goes good with the mill, especially I have the S2. Now it's the S5 is the newer version of the S2. I've had it for like 6 years. Still on the original spindle. I mill a lot of plastics, and plastics are kind on spindles. But yeah, the spindle's got to be going on 5,000, 5,500 hours. You take care of stuff, they will last. So that's one thing I can recommend. With the Roland mill, the 52 is a solid mill. It's going to be a good bit less expensive than the VHF, but it will handle its own. With plastics, it was a little bit slower. It wasn't quite as beefy, but it would get the job done. Now with the 53, the DC 53, which is our newest mill, this one has been geared to, of course, do zirconia and everything else, but it's really been geared for plastics. Plastics take torque rather than speed. A lot of zirconia needs speed. Plastics need torque. And this new 53 has it. Really is going through, and it's as fast as my VHF, and my VHF is fast. So yeah, very happy with all of them.
Thank you, Chris.
Yep. So to kind of end things, right? So you've now created a DuraFlex. One question we always have with flexible partials is, can we repair it? So the DuraFlex pucks are the same as the injectable DuraFlex material. So you can use the injection DuraFlex to repair the milled DuraFlex. And you can use the hot shot gun, or you could use an injection machine like the flex press to do a repair to a partial. And, because we could sit there and talk about how good a partial is, but as you know, you have to be able to keep a partial alive for a patient. They're missing teeth for a reason, and they'll probably start missing more teeth. And so we want to make sure we can add to it. And so here's going to be a quick overview of how you can repair a DuraFlex partial that's been created. So one cool thing about digital is you could always pull up that original digital file if it hasn't been too awful long, and you still have it. And you could go in digitally, you could extract a tooth, create a tooth in that position, print it or mill it, and then take that tooth and have that as the tooth you're going to do your repair. So there's some cool things with digital that allow for the repair to also be easy. But the hot shot is basically a handheld injector. It melts the material and allows for you to inject. Also, I will tell you that this is going to be a very quick overview, but if you go to Meyerson's YouTube channel, there's also on Zahn's channel, there have been presentations and videos that I've done showing real time doing repair with the hot shot. So if you wanted to kind of investigate that a little bit further, kind of almost do a training for yourself, those are available on Meyerson's YouTube channel, as well as Zahn's educational channel. There's going to be some things there, but in this case, we're missing a tooth. You want to clear that area. Again, if you could print the tooth, you could take a carded tooth, put it in position with wax, like you're doing a regular repair. You then do a putty matrix over the tooth. You'll then remove the tooth, boil off the wax, tack the tooth into that putty matrix. This is all very much like how a lot of us would do an acrylic repair up to this point. Then we'll load our hot shot gun with material, and the material will start to melt. We'll take our partial on the model and we'll put it into something as simple as a toaster oven. Some sort of a warming oven will work fine at about 250 degrees. What we want to do is just get it warm. Now it's only going to be in there for 4 minutes, maybe 5 minutes at the most, and it's on a model that's not a great conductor of heat. So don't worry about hurting your partial. It's not going to warp it or melt it. You're looking at at least 100 degrees, almost 150 degrees below its melting point. And again, it's on a model that's not a great conductor, and it's only in there for 5 minutes. So don't panic about that. We're just pre-warming things. Then when your timer goes off, this is the nozzle of the torch I was talking about, that blazer torch, that model number SI100. This just blows out hot air. using butane. It has no flame that comes out the nozzle. What we want to do is have the hotshot gun with the material ready to inject that's melted and liquidy in your right hand, have this torch in your left hand. You're going to heat that area for like 2 seconds, not a long time. You just want to really get that surface hot. Then before you move that torch away, you want to bring the nozzle of the gun in, inject a nice big blob of molten DuraFlex in that socket, more than what you expect you need. Then you're going to smash your putty into place, and it's going to ooze that material around, right? And that's good because it's also going to flow up into the hole that you would have placed in the bottom of that tooth, the diatoric retentive hole, right? And you're going to have flash, just like when you do acrylic repair. You know, here's flash here. You might have it on the adjacent teeth. This is no big deal. It doesn't adhere to the teeth. It only melts to itself, the DuraFlex. So that will peel off of those teeth just fine. You'll grind this excess off. And here's the tooth we added. You can see there'll be no line of demarcation. It's a melt between the old and new material. You know, really much better than doing an acrylic repair, because with acrylic repair, you're using cold cure or self-cure acrylic, which, you know, typically doesn't have as much resistance to stain and resistance, stuff like that. This is DuraFlex. This is no different from the original milled version or the injected version. This is the same material, just introduced in a little different way. So it's not going to be any weaker or any different than if you were to do, if this is part of the partial from the beginning. All right, so that's everything for the presentation. Hopefully this gave you a good overview. I think we could probably do another poll question now. And then if anybody has any questions, you can type them in under the question on the bar that you have. And I can answer, we'll read those questions off and I can answer those questions.
Yes, absolutely. Our third polling question is, we'd like to know what you're designing on. And the answers are coming in. So I want to thank all of our attendees for being so interactive with us. We really appreciate that. And Chris, we appreciate you. So thank you so much for this great presentation and for your previous as well. And we just want to let everybody know that Chris will be joining us at Lab Day Chicago. He's going to be lecturing in our glass classroom in Zahn's Ballroom, E&F. And that'll be on February 25th. That's Saturday. And we really hope that you register for his course so you can get to meet Chris in person. Also, I'd like to thank the attendees for joining us today. There will be a special promotion in your inbox from Zahn just for attending this lecture. And the promotion is only good for about 2 weeks. So if you'd like to take advantage of that, please get in touch with your Zahn representative and they'd be more than happy to help you. We do have the results, Chris, of this poll, and 22% of our attendees are using 3Shape, 22% are using ExoCAD, and 56% are using a different design software.
Cool. Yeah, that's interesting. That's nice. You know, I've used both softwares. ExoCAD I've used the longest. I got involved with that. A buddy of mine is a reseller. So to be honest, that was the reason. This was 12 or 13 years ago. And I have used 3Shape as well. And both really, as far as the partial frame software, you know, everyone will tell you this, just like I told you this with VHF as opposed to the Roland Mills. Each one has its pros and cons. And so you can be in really good shape with 3Shape, and you'd be in really good shape with ExoCAD. I know there's Dental Wings and there's a couple other software out there I am not familiar with, so I can't vouch for them. But as far as those two softwares, the softwares are concerned, you'll be really happy. So this is a picture from, so I moved my lab into a bigger facility. I guess it's been about 4.5, 5 years now ago. And I kept keeping pucks because I'm a bit of a, like, I hate waste. Like, I will turn lights off when I leave rooms, not because I'm an environmentalist or something. It's because I just can't stand the idea of wasting electricity or anything. And so sometimes I get myself into trouble when I was keeping these pucks because I'm like, yeah, I mean, they're in inventory, and I'm like, oh, look, I could do a little fixed temporary there out of a long-term temporary out of a acetal there. I could do a little unilateral, clear unilateral VisiClear there. You know, and I look at all these and I'm like, oh man, you know, how do I throw them away? Well, when I moved the lab, I started pulling them all out of my like boxes, and I kind of laid them all out on the countertop, and I was like, good grief, I have a sickness is the problem. So I now have some other technicians kind of running the mills, and they're much quicker to throw stuff away. So it's probably a good thing. But yeah, so if you guys kind of come across any questions, you can call into your rep, and if they can answer your question, they can get you in touch with me. I'd be more than happy to spend a little time on the phone with you. Again, I'll be in Chicago. I'll also be speaking on Thursday with Roland on the DC 53. So if you're interested in learning more about that, that's Thursday. And then I'm sure that Zahn will be having some specials in Chicago on their equipment and materials and stuff. It's a good opportunity. If you've never been to Chicago, you know, I started going, I don't know, 22, 23 years ago, and I've been every year except for the year with COVID. And yeah, it's a really good show to go to if you get the opportunity. Flights are relatively inexpensive. It is cold there, but you aren't going to spend much time outside except for running to go get some great food. So yeah, try to get yourself to Chicago if you can at all make that work.